Hello everyone. I'm going to discuss something about case history. Case history is a planned professional conversation between patient and doctor that enables the patient to communicate his or her symptoms, feelings, and fear to the clinician so that the nature of patient's real or suspected illness and mental attitude may be determined and the necessary treatment can be provided to the patient. Diagnostic procedure includes demographic details of the patient, history taking, examination of the patient, establishing provisional diagnosis, differential diagnosis, conducting necessary investigations, coming up to final diagnosis, and then doing the treatment plan. Types of diagnosis. We have provisional diagnosis. This is based on history and clinical examination of the patient. Differential diagnosis. It is by considering the similarities and differences between similar conditions. We rule out the lesions one by one. Then direct diagnosis. If a lesion is presenting with typical pathognomic feature, then we can give direct diagnosis. Histopathological diagnosis, it is after histopathological examination. And final diagnosis, it is on the basis of history, clinical examination, and investigation. Starting with demographic data collection, that is collecting the personal information of the patient. First is OPD number or registration number of the patient. This is very important to give or assign a particular registration number to the patient so that a record can be maintained. And if the patient comes multiple times for the treatment, every time we need not have to take history of the patient. By putting that OPD number, we can generate the history or the treatment done and we can further proceed. So it saves a lot of time and helps in the recognition of the patient. Now coming to name of the patient. Name of the patient is very important. It is first required for the identification of the patient, and then usually patient likes to be called by his or her name. Now, this will help us to elicit proper history, and it also has a psychological benefit. It helps to build a rapport between patient and doctor that encourages the patient to talk freely about his or her problem. So, advantage of knowing patient name can be identification of the patient, to maintain records, communication, and then it has a psychological benefit also. Sometime with name we can know about the religion of the patient also. Coming to age of the patient. Now, age of the patient. Knowing age of the patient has many benefits. First one is it helps in diagnosis. There are many age-specific diseases that occur on a particular age, on the basis of which we can divide it as congenital disease, then childhood disease, then adolescent disease, then adult and geriatric. So we can know that this disease occurs at this age group. Like types of dental caries also show variation with age. Pitts and Fisher caries and rampant caries are seen in childhood. Proximal caries is common in adolescent, and root caries are common in older age group. Similarly, systemic disease also they show age variation. Like congenital heart diseases, measles are more common in children. Cardiac diseases, diabetes, cancer are more common in middle age group. Atherosclerosis is more common in older age group. These are few examples. Then it is also very important in treatment planning, like if there is complete absence of teeth, that is true endodontia, even at the age of 4 to 5 years, it is frequently associated, may be frequently associated with hereditary ectodermal dysplasia. Then delay eruption of teeth may be associated with ricket, hypnism, and other local factors such as fibromatous gingiva. If permanent tooth does not erupt at its proper time, then we can take radiograph to check whether the permanent tooth bud is present or not. And if it is present, then the deciduous tooth should be extracted so that the permanent tooth can come at its proper place. Otherwise, it can lead to malocclusion. If the deciduous tooth is ankylosed, then it is preventing the permanent tooth tear up. Then we have to remove the ankylosed deciduous tooth. Then we have then behavior management also is very important, because in adult patient it is 1:1 conversation between patient and doctor, but in case of pediatric patient it is always 1:2. We have to communicate with parents also. So this behavior management becomes very important in pediatric patient. Then dose of the patient also is calculated by age of the patient. We have several rules: Clark's rules, Dilling's rules, Young's rules. In each and every formula, we can see that the age is important. We have to place the age of the patient to calculate the drug dose. Then coming to gender of the patient. Now, knowing gender of the patient is also very, very important, because certain diseases are gender specific. Some diseases are more common in males, while some diseases are more common in females. Like, for example, in males, we will more commonly see atresions and erosion, leukoplakia and carcinoma in situ, hypertension, peptic ulcers, inguinal hernia, accidents, atherosclerotic heart diseases, lung cancer. While in females, we can see iron deficiency anemia, caries, juvenile periodontitis, recurrent aphthous stomatitis, torus palatinus, disease of thyroid, PGCG and CGCG, cholecystitis. These are more common in female patient. This is PGCG is peripheral giant cell granuloma, CGCG is central giant cell granuloma. Now, even the treatment plan also will vary, because we have seen that females have more concern towards aesthetic along with function, but aesthetic is given more priority. So our treatment will be more concerned towards that. Now, females are more emotional also, so behavior management will also be a very important part here. Then consideration must be given to pregnant females and lactating females to avoid any type of drug interaction. Even the dosage may sometime vary, because females have smaller body surface area, and depending upon the weight of the patient, it may require a lesser dose as compared to male. So here the consideration should be given. Then coming to occupation of the patient. Now, occupation is very important, because it gives idea regarding the socio-economic status of the patient. In dental treatment, we have all ranges of treatment. So it is very important to know about what is the economic status. On the basis of that, we can provide the best treatment to the patient. Now, appointment timing also, some patients have night duties, some patients have day duties, so the convenient appointment timing can be given to the patient. Now we have a term called occupational hazard. This is the hazard which is occurring in an individual because that person is involved in a particular occupation. So we have some few examples that are very important, like attrition, abrasion. These are more common in people involved in the abrasive environment, work which involves more abrasive. That those material, they cannot avoid those material getting into their mouth. So this attrition is more common. Now that abrasion is more common in carpenters and shoemakers. Now tailors hold pins between their teeth, resulting in abrasion of the incisor ledge of the incisor teeth. Now, the people who are working in lead factories or bismuth factories or cadmium factories, they have a particular type of staining of their gingiva, basically the marginal gingiva, like Burtonian lines with a blue pigmentation seen over the marginal gingiva if the person is having lead poisoning. So these are all occupational hazards. Then we have hepatitis B also. Dentists, surgeons, if they are not properly taking precaution, they can have hepatitis B. Then we have varicose veins. If it is more common in people who stand for a longer duration of time, like bus conductors and traffic policemen. Then farmers are more prone to basal cell carcinoma because the middle third of the face is exposed to sunlight for a longer period of time. Similarly, workers in aniline dyes factories are more prone to urinary bladder neoplasm. So these are the hazards which are very common in the people involved in a particular occupation. Now, residence of the patient. It is important to note down the residence of the patient. Full postal address of the patient should be taken. It is very important for communication purpose also. And then we have few diseases which have got geographical distribution on the basis of which it can be classified also as epidemic, endemic, pandemic. Now, epidemic is a disease or outbreak that is rapidly spreading in a limited region, like example, malaria, smallpox, chickenpox. Endemic is a disease or outbreak in an endemic area when it is consistently present but limited to a particular region, like fluorosis. Pandemic. A pandemic is an epidemic that is actively spreading to multiple regions across the globe. Just now we have seen COVID-19. Now, area specific, some diseases can be fluorosis. Now, caries is more common in urban population. Periodontal disease are more common in rural population. Filariasis is common in Orissa. Leprosy in Bankura districts of West Bengal. Gallbladder disease are more common in West Bengal. Peptic ulcers are more common in northwestern part and southern part of India. So these are the importance of taking proper demographic details of the patient. Now coming to chief complaint of the patient. Chief complaint of the patient is the reason for which patient has visited the dentist. Now this is very important part of history taking because this helps in diagnosis as well as treatment planning. Now, it is very important to record each and every complaint in patient's own language. One should not interrupt while the patient is talking. If the patient has multiple chief complaint, then chronology should be followed. The earliest complaint, the complaint with lesser duration is registered first, and the complaint which is older will come later. Now, and this is the chief complaint. Chief complaint has three components. One should follow that. The first is the complaint of the patient. Second is the location of the complaint. And third is the duration of the complaint. So when all the three factors are noted, then we consider that the chief complaint is complete. Now, history of present illness. History of present illness is the elaboration of chief complaint of the patient. Now, this will be divided into many parts to take the proper history of the patient. This will also help us in making diagnosis and treatment plan. We will include mode of onset of the symptom, whether it is sudden or gradual, duration of the lesion. If possible, we should ask patient why do you think this problem developed? According to you, what is the reason for the problem? Now, what is the reason? What is the progression of the disease? Whether it is slow or it is fast, whether it is intermittent or it is continuous. What are the aggravating factors? What are the relieving factors? Whether you have taken any treatment for that, whether you have been benefited for the treatment or not, whether this problem is creating some other problems to you or not. All these history should be carefully taken by the patient. Now, if patient is having pain, we need to know about the location of pain, mode of onset of pain, whether intensity of pain, mild, moderate, severe, or nature of pain, sharp, shooting, dull, aching, lancinating, progression of pain, whether it is intermittent or continuous, then localization of pain, whether the pain is localized or referring to other parts, what are the aggravating factor and relieving factors. Similarly, for swelling, we will divide into location, duration, mode of onset, progression, associated symptoms, secondary changes, and recurrence. Thank you, everyone.